Good day everyone, my name is Gerald Ababa Bisara from BSN1 11F and today I will be performing the return demonstration of complete bed bath. So a complete bed bath are performed to physically wash or clean the dirt and microorganisms from the skin of critically ill patients or reducing infection risk. Now, we prepare the necessary equipment such as the basin, liquid soap, washcloth, bath blanket, bath towels, moisturizing lotions, deodorants, working gloves, and also hair comb. So now we perform hand washing prior to conduct the procedure, but I have already performed hand washing, so I will just perform hand hygiene. Okay. Hi sir, my name is Gerald Bisara from BSN1 11F, your student nurse for today. For verification, can I have your wristband please? Okay. So sir, can you please state your full name?
Joshua P. Fernandez.
Your birthday?
January 10, 2000.
Okay, thank you. So how do you want me to call you, sir?
Josh.
Okay, sir, Josh. So, in order to proceed to the procedure, I need to proceed or I need to conduct the four introductory phase, which is to close the door for my patient's privacy. Next is to adjust the room temperature for my patient's comfort. Next is to adjust the light to provide an inadequate lighting. Okay, so we're done. Now I'll be doing bath bath. This is to prevent an infection or bacteria in your body. So, sir, I'll be doing this to help you and also to inspect if there are swelling or any rashes in your skin, and also to remove all the dirt, oiliness, and other form of bacteria in your body. Is that okay with you?
Yes.
But in order for me to do that procedure, I would ask you some permission if I could hold your body parts.
Yes.
Okay, thank you so much. So now, we will don our hands using our working gloves. So let's start now. So we should raise the bed in a comfortable working height and lower down the side rails where I am standing now and assist the patient to move closer towards me. But I don't have any hospital bed, so let's assume that we have that bed. So now raise the bed. Okay, so I am assuming that I am raising the bed and adjust the railings of the bed so that my patient wouldn't fall. Okay, so adjust the railings. Let us assume, sir, can you please move forward? Let me assist you. Thank you. Okay. So, by doing that, this avoids undue reaching and straining and promotes good body mechanics. So it also ensures client safety. So now, put a blanket over the patient. Now remove the top sheet that is below the blanket. Ask the client to grasp and hold the top of the bath blanket while pulling the linen of the foot of the bed. So, sir. So I'll be putting some blanket. So sir, I will be putting some blanket on you. Is that okay with you? Okay, then great. So I'll be removing your blanket. Is that okay with you? So
Yes.
please, can you please hold it for me? Now, after removing the blanket, put it in a hamper. Now, let's remove the we need to put it on the hamper because that blanket are contaminated. So let us remove my patient's gown. So sir, can you please raise your hand? Okay. Thanks. So hold this for me. Raise your hand. Okay. Please, I'll be pulling your gown. Okay. So after removing the patient's gown, we have a warm water, 2/3 full. It is about 43 to 46 degrees Celsius. Let the patient check the temperature if it is tolerable to them. Okay? So sir, can you please hand over your hand for me? Can you please check the temperature? Is it okay? Okay. Thank you. So warm water is comfortable and relaxing for our patient. It also stimulates circulation and provides for more effective cleansing. And then remove patient's pillow if the patient's conditions allow and raises the head of the bed to 40 to 45 degrees. So let us remove my patient's pillow. Okay. So let us assume that this pillow is my patient's bed, like an elevated bed. Let us assume about that. So can you please put on top? Okay. Thank you. Okay. So now remove the pillow and place the bath towel under the patient's head and over her chest. So a towel prevents chilling and keeps the blanket dry, and removal of pillow makes it easier to wash patient's ears and neck. So now I am doing is I am gonna wash my patient's face. But before that, I will put some blanket in his neck area or in his head area. And now, I will put some blanket into my patient's chest so that if I could wash his face, I can just pat dry his face using this towel. Okay. So now ask the patient if he wears contact lenses. Sir, can you please go above so that I could properly wash your head? So assume that this is a hospital bed. I'm sorry about that. So, sir, do you wear any contact lenses right now, or do you wear contact lenses? None. Okay, that's great. So I'll start washing with your face. So, okay, I will just set aside this. Okay, so for me to easily wash or rinse the towel, I will put the water on here so that I could properly rinse it. So I would first wash his inner and outer canthus. So right now I am making a mitt. Okay, so now pat dry the area. then rinse the mitt. Now, by using that, it prevents the spread of microorganisms from one eye to another. So, prevents secretions from entering the nasolacrimal. Okay, so now let's proceed in forehead. I am making a mitt again. So this mitt has its four sides, so I can use either the sides that I want, especially the dorsal, the sides, and etc. So after the forehead, the cheeks. Then pat dry the area. Now let's rinse the towel. Now let's proceed into my patient's nose and neck and ears. And also chins. We should not neglect that area. Then pat dry the area. Then rinse. Then after that, discard the towel, or you can just put it on the hamper. Then use another towel for the other part of the body. Okay, then ask the patient, or if he likes to shave his beard. So sir, do you want to shave your beard? Okay, great, thank you. Next, as we were gonna wash our patient's arms and hands. So exposes the patient's forearm and places the bath towel lengthwise beneath the arm. So, sir, I will just get this towel. So since that this towel is lengthwise, so I will just place it on here. So can you please hand me your hand? Okay. Thank you. So fear of stroke start from the wrist to shoulder, including the axillary area. So from the wrist to shoulder. Okay. So I am using another towel. Let us wash the towel. Okay. So we are doing meat again. Meat. Raise your hand. Okay. Then pat dry the area. Then after pat drying the area, rinse the towel. Next is the axillary port. Again, we will make a bath mitt. So can you please raise your hand for me? Then after that, put it on the water, then pat dry the axillary area. Okay. And then place a towel on the bed and put it in a wash bin on it. Then place the client's hands in the basin. So I will just put some, or I will just get some towel. Okay. So can you please put it? Thank you. So Repeat for hand and arm nearest you. Caution if an IV infusion is present, and check its flow after moving the arm, and avoid submersing the IV site. And dressing site is not a clear transparent dressing. So a clear transparent dressing will keep water from an IV site. However, a gauze dressing becomes contaminated when it becomes wet with the water. So if you see that I am really cleaning the interdigital spaces, because microorganisms can launch into the interdigital spaces in our fingers. So if I were you, properly wash it. Okay, then we're done. And top. Then after doing that, pat dry the fingers. Okay. Now we should transfer to the opposite side. Okay. So let's get first the towel. Thank you. And cover the hands for my patient's privacy. Now let's lengthwise again the towel. Okay, then place it into my patient's hand. So sir, can you please okay. I'll just put the basin here so that I can move freely. Okay, then wet the towel. So you can see it properly. I will just put the basin here. Then use a bath mitt. Okay. Then put the bath mitt, wet it first, then pat dry the area. Then make a bath mitt again for the axillary. Can you please raise your hand for me? Okay. Then pat dry. Then put some towel. And then place your basin into your patient's towel again. Let us move properly wash my patient's fingers to really clean his interdigital spaces. Then after that, pat dry. Okay, we're done. So let us set aside first the materials. Now that's all for the arms and hands. Again, let us discard the towel that we've used. Now we will proceed to wash our chest and abdomen. Now let's proceed to the chest. Place a bath towel over his chest while I lower down the back blanket just above the umbilicus. So as what I have told you, let's place this towel into my patient's chest. So sir, can I have the towel? And don't forget to cover the patient's exposed body part. Okay. So can you please hold it for me, this one? Okay, so pay special attention to the skin folds under the female's patient's breasts. But my patient is a male, so I don't have that kind of problem. So next is spreading the towel across the patient's chest will avoid unnecessary exposure and chilling. Dirt usually accumulates in between skin fold. So now we were gonna wash my patient's um abdomen. Now let's use another towel. So let's use this. Let's create a bath mitt. Okay, so then rinse. Okay. So check and changes the water as necessary. So drapes the patient's chest and abdomen using a towel and a bath blanket as what I have showed you earlier. And now we're done about that. Let us discard the used towel. And now we will return the blanket into its original position. Okay, so hold it for me. Thank you. Okay. Okay. So now we will proceed in washing my patient's legs and feet. So now let's proceed to the legs. In order for me to wash his legs, first thing to do is to expose her legs by folding the back blanket to the midline and then place a back towel beneath her or his legs. Okay, then lengthwise, don't forget that. So let's expose the part that we need to. Okay, so can you please do like this? Okay, that's great. Okay, properly secure the blanket so that the other parts shouldn't be seen or shouldn't expose. Okay, then let us use another towel for that. Again, let's create a bath mitt. Again. And then rinse. And then pat dry the area. Now, let us straighten the legs, then cover the seam body part. Then next, we should transfer to the other side. Okay, we'll just get the basin and the towel. Now let's place the towel. Okay, so can you please? Thanks. So let us first make a bath mitt. Okay. Then rinse. Then pat dry. Okay, then cover the body part. Next, should not neglect. I just covered the body part so that the other parts would not be exposed, but we are not done yet. Now, let us soak our patient's feet or nails. Can you please fold your foot for me. Okay, very nice. Now let us clean the interdigital spaces. Okay. Now we're done about that. Then don't forget to pat dry. Now cover the seam body part. Pat dry. Let's go back to the other feet. Pat dry. Now cover the areas. Okay. Now, that's why you do that, to obtain fresh, warm bath water now when necessary. Then, water may become dirty or cold because surface skin cells are removed with washing. The bath water from dark skin cells removed washing. The dark skin clients may be dark. However, this does not mean the client is dirty. Wash glove hands. So changing the clean supplies decreases the spread of organisms from the anal area to the genitals. Now, for the last part, to wash the back. So now let's use another towel again. Okay. So I am going to turn my patient into a prone position, lower the bath blanket, exposing the buttocks. Lay towel along the side of the patient. Sir, can you please face that side of the room? Okay. Thanks. Okay, so I will just expose your back. Now let's create a black knee. So start cleaning the patient's back, paying special attention to the patient's skin fold. Fecal material near the anus can be source of microorganisms. So prolonged pressure on the sacral area or other bony prominences may compromise circulation and lead to the development of the cubitus ulcer. So let's create a black mat. Okay, let's rinse. Since that my other blanket is contaminated, since that I wash his feet, so I will just use this kind of towel to pat dry the area, to pat dry the back area. Okay. Okay, now we're done. Now let's discard the towel and the blanket. Now let's cover the exposed area. Sir, you can just face me. Thank you for participating. So, use powder sparingly. Release a little possible in the atmosphere. So this would avoid irritation of the respiratory tract and powder inhalation. So excessive powder can cause caking, which leads to skin irritation. So for the last part, help the client put on clean gown or pajamas. So let us change all the blankets. Let us dispose this. Let's change that. Okay. Now let's dispose all the basins, the water, the gloves, and etc. Okay. So can you please put your hands? Okay, thank you. Okay, so I will pull this blanket. Is that all right? Is that okay? Okay,
Yes.
let us discard this and put it on the hamper. And lastly, the blanket, the new blanket, to provide comfort, warmth to the patient. Are you comfortable with that?
Yes.
Okay, thanks. So assist the client to take for hair, mouth, and nails. Some people prefer or need mouth care prior to their bath. So, sir, do you want me to comb your hair,
No.
to brush your teeth, or to anything that you want, especially deodorant? Okay, that's great. So next is the places the signal device near the patient, and thus the aftercare of equipment. So I was just putting a signal here in my patient's side so that he could just communicate me whatever he wants. Okay, just click this, okay? I will just put it here. Then remove gloves, so I just remove it, and especially that I touch the patient, I touch the equipments, and I touch all the paraphernalias that here on the room. I really need to do hand hygiene to, to refrain from microorganisms, to refrain from other harms in our health. So let's disinfect our hands. Okay. Then perform documentation and reports. A careful record is important for planning and individualizing the patient's care. So I will be doing documentation, but before that, let us set aside this so that the room wouldn't be messy. Okay. Okay, so what is your name again, sir?
Joshua Fernandez.
Your birthday?
July 2004.
Okay, great. So I am done. I am done performing the complete bed bath. So it includes to wash your face, to wash your abdomens, your hands, your feet, and your back. Okay, so I will just summarize everything in here, and I will indicate everything, all the procedures, so that your physician would know that I have done that procedure. Okay. Okay, that's great. Thank you so much, Sir Joshua. Have a nice day. Good day.